Hello, my name is Sean McNair. I'm a student physical therapist from Howard University, and today I'm going to be presenting my capstone project to you guys. My capstone project is titled Conservative versus Surgical Treatment for Thoracic Outlet Syndrome, a Systematic Review. What is thoracic outlet syndrome? So, thoracic outlet syndrome is described as the compression of the neurovascular structures, the brachial plexus, as they exit through the thoracic outlet. TOS is estimated to occur in about 1% of the population. In a study that was conducted by Physiopedia, it was found that 3 to 80 people amongst a sample size of 1,000 people were to have a positive test for TOS. Typically, TOS is more prevalent in women than men due to decreased muscle development and muscle tone, a greater tendency for rounded shoulders due to the development of breast tissue, and a naturally narrowed thoracic outlet due to an anatomically lowered sternum. And the typical age group that this affects is 20 to 50-year-olds. What is thoracic outlet syndrome? Thoracic outlet syndrome is an umbrella term that groups together multiple types of TOS. TOS is considered an umbrella term that takes into account a group of disorders that is caused by the compression of nerves, arteries, or veins that pass through a tight passageway between the clavicle, first rib, into the upper extremity. There's multiple important structures that can be affected that pass through the thoracic outlet. You have the brachial plexus, the subclavian artery, and the subclavian vein. What is thoracic outlet syndrome? So this is one of our 3 types, known as neurogenic thoracic outlet syndrome, or NTOS, and this occurs when the brachial plexus is affected. It is typically responsible for about 90% of all cases. Then you have venous thoracic outlet syndrome, which is when the subclavian artery is affected in 3 to 5% of all cases. And then you have the arterial thoracic outlet syndrome, or ATOS, which is when the subclavian artery is affected in about 1 to 2% of all cases. Here are some of the signs and symptoms of thoracic outlet syndrome. Thoracic outlet syndrome commonly presents with pain, paresthesia, reports of weakness, increased fatigue, and a decrease or absence of sensation. Typically, all of these are found around the head, neck, face, and into the upper extremity. Some anatomical landmarks that are important to know for thoracic outlet syndrome are the interscalene triangles, costoclavicular triangle, and subcoracoid space. The interscalene triangle consists of the anterior scalene muscles anteriorly, middle scalenes posteriorly, and the first ribs inferiorly. The costoclavicular triangle consists of the middle third clavicle, posterior medial aspect of the first rib, and the posterior lateral border of the scapula. The subcoracoid space border consists of the coracoid process superiorly, the pec minor anteriorly, and ribs 2 through 4 posteriorly. So here is a picture of the interscalene triangle. So we have the anterior scalene muscle here, and then we have the middle scalene muscle here, and then right underneath here, this is the clavicle, and then the first rib would run right around here as well. And as you can see, this is where the brachial plexus and then those arteries and nerves are running very, very close. Then looking at the costoclavicular triangle, we have the middle third of the clavicle, which would be right here. And then we have the first rib, which is going to sit right here. And then we're looking at the posterior lateral scapula, which is going to be right in here. Okay, now for the subcoracoid space. It consists of the coracoid process, pec minor, and ribs 2 through 4. And again, here's another picture of it. Okay, purpose. What's the purpose of this research study? It's a systematic review that examines the effect of conservative treatment to reduce the complications of thoracic outlet syndrome compared to surgical treatment. The significance. This research study's objective is to provide clinicians with evidence-based information to offer the most effective and accurate treatment for individuals experiencing complications of thoracic outlet syndrome in the upper extremity. Here are my research questions and hypothesis. Is an isometric exercise program more effective in reducing numbness and tingling in treating an adult from 20 to 40 with thoracic outlet syndrome compared to no treatment? And if an isometric exercise program is performed on an adult from 20 to 40 with TOS, then there will be numbness and tingling symptoms. Then numbness and tingling symptoms will be reduced. Next, what is the most effective therapeutic exercise program in reducing pain out of manual therapy, isometric exercise, and active exercise for an individual with thoracic outlet syndrome? If active exercise is used in treatment for someone with NTOS, then the patient will the patient will score significantly less on their DASH questionnaire. Here are my next two research questions. Is a PNF-focused treatment plan for an adult from 20 to 40 with thoracic outlet syndrome effective in lowering their DASH score? And then next, is a purely isometric exercise program more effective in reducing numbness and tingling based on the DASH than only a surgical intervention on patients from 20 to 40 years old with thoracic outlet syndrome? Next, we're going into our methodology. So now I'm going to talk to you about our search strategy. The research databases that were used to complete this research were PubMed, JOSPT, and Google Scholar. And all of these searches happened between March and June of 2024. And along with the research databases and scholarly articles, such as textbooks and credible websites ending in .gov or .org were used, and we refrained from using gray literature. The only articles that were published between 2000 and 2024 and published in English with full text availability were used. Many of the articles were found to be randomized control trials and systematic reviews, and some of the key medical subject heading that were used was thoracic outlet syndrome, pain and paresthesia, pain, numbness, and treatment types. Some of the inclusion criteria were 1, subjects who were diagnosed with thoracic outlet syndrome, 2, subjects who are older than the age of 18, and 3, subjects who found tenderness around the clavicle and the brachial plexus. Some exclusion criteria that we used throughout this study were studies excluded participants who had a prior nerve block procedure, prior steroid injection, presence of cervical instability, presence of malignancy or cancer, and there was a hypersensitivity to medication. And this is where my Prisma diagram will go once I finalize that.